I got called to be the rector of this church 6 years ago. I came here from Duluth, Minnesota, although I'm originally a native Californian. So I came here 6 years ago. I'm bilingual. I wanted to work near the border. I wanted to be somewhere that my linguistic skills and my background in anthropology might be helpful. And this church called me, and that's how I got involved. You can't be rector of this church and not be involved with the clinic. So it's really a wonderful thing to see. But I started September 2nd, 6 years ago, and the clinic was 2 days later. And I've been an interpreter in orthopedics ever since. I work with the families that are going to hospitals in Spokane or Sacramento for orthopedic surgery. This clinic was started actually on the other side of the border. And, but for American doctors to work with it, it needed to be on this side of the border, and St. Andrews gave it a home, and it's been a home for the clinic for 36 years. We host it every Thursday, first Thursday of every month except July. They come and do cooking for 2 days prior. The day prior, there's a lot of setup. Jim's involved with that, and then clinic day. You're seeing it here today, clinic day. So it takes volunteers from both sides of the border. We have. It's a really wonderful sort of intercultural meeting here. We have people, monolingual English speakers, monolingual Spanish speakers, and lots of bilingual people. And it would not happen without the volunteers from both sides. Well, we have a 36-year track record. 36-year track record of bringing people over. We have a limit on the number of people who can come over that don't have regular visas. They get special permits. And immigration folks have worked with us very well all those years so that the patients can come across for clinic day. And then if they do have to go for surgery elsewhere, they work with us to get them to go to surgery at the Shriners Hospital. So it's been a wonderful cooperation. You know, there's wonderful miracles that happen. There are those moments, you know, when a little girl who's 3 years old, who's never walked because her legs weren't formed right, who gets her first prosthetic devices and takes her first steps. That's pretty moving. I work with families who are going to go for surgery, and most of them have never flown in airplanes. Most of those families are monolingual in Spanish, sometimes even have an indigenous language. And so part of it is sort of being their coach as we interview them and sign them up. We actually fill out the hospital administration papers, admission papers with them here. So going through that process and trying to explain to them what they're going to encounter at the hospitals and what the life is going to be like, what the surgery is going to be like. And often they have to be there for long periods of time if they require therapy afterwards. So some families go for a week, but some families go for 3 or 4 months. So that's rewarding, kind of helping them calm down a little bit. And what I think most impresses me is the dedication of the parents who want the best for their children, and who will, scared as they might be, to get on an airplane and fly into a foreign country, you know, and face high-tech surgery, but they will do it for their kids. And the dedication is amazing. We have some kids who need constant treatment or come back on a regular basis for checkups or whatever, or sometimes additional surgery, and the parents, they may travel 8 hours by bus to get here. I've had one girl her parents brought her 16 hours by bus to get her here. So I think that's what's most inspiring to me, is how these parents want to do what's best for their children.